because when I look at myself, I can sometimes see my mother, and I would rather not.
Hi, my name is Rebecca. I'm from Dr. Ellen Turner's office. This is our lovely client, Brenda, who is coming to us today with some cosmetic concerns and issues. So Brenda, what brings you to the office today?
I'm going to be reaching my big 6-0, and I would like to freshen up my face. My skin is sagging. I can see that it has dropped. I would like to look a little bit fresher, a little bit more youthful, and mostly natural. I don't want to look like it's
overdone.
The overdone.
Absolutely,
yes.
Absolutely.
And so that's why I'm here. I just want to see what is available now, and I just would like to have all this pulled back up.
Lifting, tightening of that.
Yes.
Your skin looks amazing, so you're really wanting to concentrate on just the lift.
Exactly.
All right, well, Dr. Turner's going to be on her way in here shortly, and she's going to go over InstaLift and options you have and procedure protocol.
I'm Dr. Ellen Turner in the dermatology office in Dallas, talking with you about a new procedure, the Silhouette InstaLift. And we have our lovely patient here that we're going to use as basically a model to show what is involved in InstaLift. She's already described to us how she feels and the goals that she has. And now we're going to talk a little bit more specifically about this Silhouette InstaLift procedure. So with regards to this patient, when you look at her, you start to see that she's gotten a little bit heavier, and she's also lost some volume in this mid-face area. And what that's doing is it's creating some heaviness down in this lower face area. So the neat thing about InstaLift is it's a simple 30-minute procedure, thereabouts. It's very similar to putting in a filler product, but instead of filler, we're now using threads that are composed of sugar molecules. So we take these threads and we're going to mark the face in 3 areas. And basically we're going to cause or create a lifting effect using the 2 to 3 to 4 threads on either side. So we're going to use that to give an instant lift. And when I use my fingers to mimic that response, what we see is a softening in this lower area and more of a volumization where she needs that. So instantly a lift, and usually 3 to 4 months of volumization using the product. We'll kind of do a real close-up. I was telling this patient, this actually is the actual size of the thread. So this top layer is the one we're looking at with 4 cones. That's typical, and that's used in the mid-face where we're talking about. So when we think about it, we would actually start at our point where we're going to go past the cones. So usually it's going to be somewhere around here, here, and again back here, inside the hairline. That's one thread, okay? We would repeat. And lastly, we would do an insertion. So what happens when I do actually go in with this patient? We would first of all numb all of these little areas that I've marked in pink. Okay, so that's a simple little lidocaine injection. Feels similar to a bee sting. Okay, and then what we would do is we take the thread that contains the sugar molecules and we'll actually thread it through here and insert and come out here. Okay, so now we've placed our first set of cones here, and then we take the same needle on the same thread, thread it through this hole, and it will come out through this hole is going to be the exit point. So now we have this nice contiguous strand that we can use to essentially do what we talked about earlier, which is the pulling, the lifting effect. But it's not just about lifting. That is what we do instantly, but then we get the fill effect later. So again, we just repeat that on the same side. Some people even could do a 4th strand. So with this patient, if I was going to do something like that, we would take it up in this vector and we would start about here, here, here. And by doing so now, you would even get a further pull on this area here, which would be very youthful. So Silhouette Instalift, a great lunchtime type of procedure, after work type of procedure that can be done usually within 30 minutes, minimal recovery time. There's going to be some bruisability and slight swelling, but that's as expected with any filler. And the advantage is really that it looks natural and that now you're getting 2 essentially for 1 procedure. You're getting both the lifting effect as well as the filling effect. And no downtime. Other than the local anesthesia, no anesthesia. So it's really a nice procedure that Dr. Ellen Turner will be doing. Some of these you can look on YouTube and see more about our procedures that we've already done, and then you'll be able to see this patient getting her procedure done as well.